My name's Helmi Khadra. I'm an endocrine and oncology surgeon here at Houston Methodist. I've been here for about almost a year and a half now. I'm originally from Chicago. I did my surgery training in New Orleans at Tulane University, and then I did a fellowship in endocrine and oncology surgery at Yale University in Connecticut. So when I first came to Houston Methodist, one of the things I was really excited about bringing with me from my previous experience was radiofrequency ablation. The entire hospital was extremely supportive in getting me everything we needed to launch the program, and within a few months we were able to do our first case, and we've very rapidly grown since then. It's a new technology. It's only been FDA approved for a few years now. It hasn't been adapted as quickly for the thyroid, mainly because behind the thyroid there's the recurrent laryngeal nerve, which is an extremely sensitive nerve for our vocal cords, and then also our carotid and jugular vein. And so we're always worried, extremely worried about the heat injuring any of those structures. But recently they've developed new probes with a lot finer area of energy that we can use for the thyroid. And we've had tremendous success with treating people with benign thyroid nodules and treating their sizes and treating their symptoms without doing any kind of surgery. So it's a non-surgical procedure. We percutaneously insert a probe into the thyroid tissue. And once the probe gets into the area of the nodule or whatever the tissue we're going after, it generates heat and then allows for necrosis of that tissue and for that tissue to shrink. The benefits of radiofrequency ablation for benign thyroid nodules is first, there's no scar, there's no incision, and there's no downtime compared to needing surgery. The second is about 50% of those patients are going to need to have thyroid hormone supplements after the surgery. And so the big benefit of radiofrequency ablation is almost none of those patients will need to have any kind of thyroid hormone supplements. Another huge benefit of radiofrequency ablation, patients with what we call toxic thyroid nodules or hot thyroid nodules, meaning that that nodule is producing too much thyroid hormone. Typically the treatment of that is surgery or radioactive iodine. We've done some of the most in the country here at Houston Methodist of doing toxic thyroid nodules. And so when the patient wakes up, there's no visible scars at all. It's an outpatient procedure, and they can go back to their normal lives, the very next day. I always tell patients when they wake up, they're not going to notice anything different about their thyroid nodule at all. What happens is, over the period of weeks and months, it will continue to shrink. And usually from about 6 months after the procedure, they get about anywhere from 50 to 70% reduction of the size of the nodule. We started the radiofrequency program at Houston Methodist 6 months ago. We've done anywhere from about 45 to 50. There's very few people in the country that have started to do it, but I anticipate it to be rapidly growing very quickly. We're doing more and more every month with more and more of our referring providers and patients learning about this non-surgical technique. And so I anticipate, for the future, for a lot of these people with benign thyroid nodules or goiters with compressive symptoms and those selective patients, that we're going to be doing radiofrequency ablation on a lot of them.